Good morning, everyone. Welcome to this Q&A session that rounds off our virtual science and health event this year. So we're very fortunate to have a number of our PhD, undergraduate medical students, postgraduate medical students, and some of our staff are also on the panel this morning to field questions that our sixth form students might have for us today. So I'm first going to ask our panelists to briefly introduce themselves to tell us where they're at with their career or training, and then I'll start to work through the questions. So looking at the top of my screen, Amy, I think you're up there first. If you wouldn't mind saying a little bit about yourself, please.
Yeah, so I'm Amy. I'm a PhD student. I'm in my first year, and my project is kind of on genetic diseases and trying to find out why some people get colorectal cancer and some people don't. Yeah.
Excellent. Hey, thanks for that, Amy. Sahana, you're next along.
Hi everyone. My name is Sahana. I'm a third year medical student, and very excited to be here. Happy to answer the questions.
Great, thanks, Sahana. Rosie?
Hello. Like Amy, I'm a first year PhD student, and my project is looking at retargeting viruses to fight cancer.
Fantastic. Thanks, Rosie. Lee?
Good morning, everyone. So I'm a GP 1 day a week, and I'm also a PhD student in my first year, like Rosie and Amy, and my research is looking at recurrent urinary tract infections in women.
Thank you very much, Lee. Nia?
Morning, everyone. Baradat Pau. I am a second year PhD student looking at a virus called HCMV and how it interacts with part of the immune system, and then also how to make drugs or small molecule inhibitors to stop this interactions.
Great. Thank you, Nia. Diolch. Alex? Alex, are you able to unmute?
Yeah, good morning, everyone. Yeah, I think my Wi-Fi is a little bit jumpy, but I hope you can hear me. I'm sorry. So yeah, I'm Alex. I'm a final year medical student. I'm my last year of studying. I'm currently on my elective. So I'm working in Portsmouth at the moment. I'm working in a sort of research project evaluating digital health consent process across the paper, inside the paper consent process. So yeah.
Great. Hey, thank you. Thanks for being with us this morning, Alex. Toby, you've just hot-footed it from some teaching. Great to have you. If you could briefly introduce yourself, please.
Hi, my name's Toby. I'm a third year medical student at Cardiff.
Great. And then we've got a number of staff members. Francis, you're next along my list there.
Hi, I'm not under my name there, so I was asking if I could be renamed. Naomi and I are sharing because of other things going on, but I'm Francis Jarron. I'm currently covering the admissions section of the medical school. I'm the Director of Community Clinical Learning, and I'm a GP.
Great, thank you. Do we have Naomi as well, Francis?
You do. Unfortunately, my video isn't working at the moment, so I'll try and sort that out. But yes, so I'm also a GP and work with Francis. I'm part of the admissions group and also lead on the selected student components in the community and health inequalities in the curriculum.
Fantastic. Thank you, Naomi. And Derek, to complete our panel, if you wouldn't mind.
Hi, I'm Derek Lang. So I'm the director of the BSc in medical pharmacology, the only BSc that is run at the medical school. I run admissions for that program, and I also join in with Francis and Naomi on the medicine admissions group.
Great. Okay. Well, thanks, everyone. So if we could start, probably there's a question I suspect that's more directed for Francis and Naomi. Applications for medicine and dentistry reached record numbers this year once again. It's clear that several universities adjusted their entry requirements, especially UCAT thresholds, to try and filter the numbers that they could conceivably interview. So what changes, if any, are the medical dental schools at Cardiff considering to their admission policies? For example, the medical school's 2021 admissions policy mentioned that they were considering introducing a new situational judgment test called CASPER. Is this still the case? So quite a technical question there, but if you wouldn't mind getting started.
I'll be happy to start. Well, the first thing is we have made no firm decisions until we've actually released this year's lot of offers, and we're not quite there yet, although it will happen this month. Okay, so you're absolutely correct. And one of the problems all medical and dental schools face is not only that overall trends going up, but also fashion. So this year we happen to be in fashion. We're not always in fashion. So we can't predict from one year to the next whether we're going to get 2,500 applicants or, as we did this year, 4,700. So it will vary hugely. We are not introducing CASPER for next year. We will be looking at reviewing our policy, and we'll make it clear in any policy if we make any adjustments at all. It is correct to say that although we did, for non-contextualised candidates, have to use a UCAT threshold this year, but we only determined it after we had looked at all the academic requirements, and our UCAT threshold was lower than most of the medical schools in the UK. But we will be exploring this in detail, make certain all information is out. I can't answer for dentistry, I'm sorry, but it is worth contacting the dental school, but they're probably looking at similar measures. Hope that helps.
Thanks, Francis. I don't know if you wanted to add anything, Naomi.
No, I think Francis has answered everything in a minute. Thanks.
Great. So we had a question earlier this morning from Karis, and Karis was asking, as someone in year 11, what would you say is the best way to get ahead in terms of gaining a place for medicine? So, and perhaps we could broaden that out a bit as well in terms of what Cardiff University is looking for generally in a student. Maybe Derek, you could come in on that. So maybe some of our medics might give some advice on, you know, gaining entry into an undergraduate medical course. Anyone got any pointers?
I think
Sorry,
the best thing you can do is, sorry, Alex, go on. Okay.
No, you go for it.
Okay. I think the best thing you can do as an aspiring medic is really just to be yourself authentically, because that's at the end of the day what differentiates you from other people. If you have a checkbox in your head that makes you the perfect medic, chances are other people are going to use that checkbox as well, and then you're just going to be like everyone else. So the best advice I ever got was just to, you know, highlight the features that make me me, and how those might make me a good medic. For example, like things you do at school, like if you do like debating clubs or sports or leadership positions. I used to do Model United Nations a lot, so like that really helped me, you know, with public speaking and being confident and things like that. So I think if you highlight those things that are personal to you, medical schools tend to appreciate that. That's something I've noticed.
Great, thank you, Sahana. Maybe the panelists could either use the hand sign or just put a physical hand up to let me know when you like to come in. Toby, I see your hands up.
Yeah, I found that a lot of my course mates, and when I was applying, volunteering projects were really good. Good thing to have on your CV, and shows that you're like committed. But then a lot of some of my mates worked as HCAs, so healthcare assistants, and I feel like that gave good insight into what a career in medicine might be like, and it's something you could do. I don't know when would be the best year to do it, but maybe in the summer, and it gives you an idea of what working in the NHS might be like.
Great, thank you, Toby. I know, Alex, you wanted to come in earlier.
Yeah, I would love to come in. Could you just repeat the question? Because my Wi-Fi dropped out when it was being read out.
I just wondered if you had any pointers for someone in year 11 who's thinking of applying to do medicine. What advice would you give?
Okay, yeah. So I think everything Sahan and Toby touched on is fantastic, and so there's some great resources. I think Naomi might mention some of them. The Passport to Medicine, the Cardiff University releases. That is a great starting point. So if you search that in the browser, that gives you some great tips. Sort of starting to think about medicine is kind of a bit of a journey. You know, in year 11, there's so many things you can think about, you know, a work experience, and a lot of this sometimes takes a bit of time. So being very proactive and researching ahead of these time points is really important. So if you're thinking about work experience, you know, think a couple of months ahead in advance to reach out to many people, try and find as many opportunities out there as possible. But I know there's a lot of difficulties with COVID at the moment, but there are lots of great webinars online where students pupils can learn about medicine from you know, cases from different doctors who talk about their careers and what they do. And there's some great ones from different Royal colleges, some of the medical widening access groups online do these sort of talks. So it's really worthwhile exploring these initiatives and see if you can gain some experience about medicine before you apply. But the Passport of Medicine is really great and has lots of great tips. I'd recommend really taking a look at that.
Great, thanks, Alex. Naomi, I think I saw your hand up earlier.
Yeah, I think Alex has covered a lot of what I was going to say, but I think also to say, actually, sometimes it's as good to have an experience to realise that medicine isn't what you want to do as well. So having these experiences and reflecting on them and deciding whether that is something that you would like to do in the future is really important as well. And I think the really important thing is to remember is to reflect on what you've got out of those experiences as well, rather than just do them. What have you actually gained from them? That's what we're really looking for.
Great, thank you. Maybe I could bring some of our PhD students in at this point. And what have you learned so far in terms of what you think is needed to make a good research scientist? Anyone got any inputs as to what qualities you think might be needed for someone who's thinking of going down the bench scientist route or epidemiology route?
I know most people are asking questions about medicine, but being a doctor isn't the only route into science.
Yeah.
So yeah, I think I did genetics at my undergrad, and then I worked in a bioinformatics lab, which is like a computer lab that uses like biological data to find things out. And I think that's mostly about passion and drive, and like having an interest in something and not stopping until you've got the skills that you require. So yeah, medicine's not the only route, as me, Rosie, and other people can show you.
Yeah, absolutely. Rosie, see your hands up.
Yes, I think Amy's right there that there are other routes into medicine, because when I was in year 11, I thought I was going to study history. So I didn't expect to end up here doing my PhD, but I think, as Amy said, being interested and being willing to learn all the time, because everybody will be able to teach you something. And I think as long as you're willing to listen to everybody and see that there's opportunities to learn everywhere, that's quite a good skill to develop in kind of year 11 and to start really listening and learning from other people.
Absolutely, yeah. Thank you, Rosie. Yeah, so yeah, biomedicine is obviously a much broader church than just medicine itself. So yeah. Nia?
I'd also say a passion to learn. So if you want to learn more, so it's the drive of knowing that what you're doing as research is new. It's something that hasn't been done before. And I find that really, really interesting. And then you have to draw conclusions from lots of different sources. And then you go through what you think might be the right answer, which might not be the right answer. And it's just the wanting to find something new out. It's that drive that makes a good scientist.
Excellent, thank you, Nia. Lee, you're interested because you straddle both worlds, of course.
Yeah, so I've got both hats on. I think going back to the kind of applications, I think I can't remember who mentioned it, but I think one of the key things is when you have an experience, or you do, it can be even anything trivial, but it's how it reflects to medicine and how that would make you a good doctor. And it's always reflecting that in your answers, whether that's in your application or interviews, I think is important. But I also think either for research or medicine, it's really important you do your research and really look into what it involves both. And so you really know what you're getting yourself in for. I'm biased, and I say I enjoy both aspects, but part of my application for both of them was really researching and seeing what it involves. So I'd really advise you to do that to make sure it's the right career for you.
Yeah, great, thank you. Derek, if I could perhaps bring you in at this point as admissions tutor for our pharmacology undergraduate degree. What is it you look for in a candidate, and what makes a good student on your course?
Well, I would say somebody, I think I said this earlier on, that somebody that knows what pharmacology is for the start. That's probably a good thing. You know, everybody thinks it's the marriage of biology and chemistry, so which it is. And so we are looking for somebody who's inquisitive, insightful, observant, enthusiastic. We haven't got a real picture of our ideal student, but yeah, those qualities are good. So for us, we have an absolute requirement for chemistry, then biology and maths, and then the third subject can be something else. I was just in the process of replying to Caris there. She put an email, a message in about A-level subjects. Have I got to do 3 sciences? So you definitely have to do biology and chemistry for medicine, but the third subject can be anything else. At open days, we get asked this quite a lot. So, and I would say, yeah, do the third subject, do something that really interests you. So, something like history or a language or, something like that, because we want nice rounded individuals that come to us. You've got lots of different skills, not just that you got your heads buried in a book the whole time. And, somebody who's got, good social skills. So you could do an A-level in PE, for example, something along those lines. So yeah, there's a lot of variety there, and do things that you enjoy, not just things that you think that your teachers are saying, this is exactly what you've got to do. I did biology and chemistry and physics, and that was probably one of the worst things ever, to do physics. But that was me anyway. So,
thank you, Derek. So one of our attendees is struggling a little with her personal statement, or his or her personal statement. Could anyone give me some tips, please? Are there any obvious do's and don'ts with that personal statement? Alex.
So I think with personal statements, they're always very difficult to start off with. It brings together all your experiences and what you've done up to an application point. And it's a very challenging process. But like I think Sahana mentioned, think about you as an individual, what makes you different. Write down all those different points that you've done. So your voluntary experience, what hobbies outside of school, what you've done in school, your achievements. So write them all down, and then think about how you're going to structure. So usually the structure is not fixed, but usually structure is sort of introduction, and then you've got your main body, talk about your why you're interested in medicine, firstly introduction, and then you talk about what you've done to explore medicine or science, or explore a healthcare course that you're interested in, and what you've done. But the most important thing in any of it is to reflect on what you do, and exactly what Naomi said, reflect on what you've done, how it made you feel, and how that will make you a good doctor or a good researcher. It's really important to reflect on how those experiences shaped you. And it doesn't have to be sort of science related. Obviously, it'd be nice to have 1 or 2 science experiences there to show you're interested in that. But it can be, you captained a football team, and you can relate that back to how that will make you a better doctor, because being a doctor or a researcher a lot of time requires leadership skills. So you can really reflect back to that, and you can integrate what you learned there into how that will help you in your future career as a researcher or a doctor. So really reflect on all the experiences you have and how they will make you a better candidate, or better doctor or researcher in the future. So that would be my personal tip.
Great, thanks, Alex. Sahana.
I think Alex has put it quite succinctly there. It's very, very comprehensive answer, and I agree with all of it. I might just add a few points to what he said. So I think in terms of structure, what I was told about the introduction is, if you think about it, examiners are reading so many personal statements every day. Like, how are you going to make yours stand out? So if you make your introduction something that stands out, maybe like a personal story, something that happened all of a sudden that triggered some thoughts, that is kind of going to stick in an examiner's mind, rather than someone who just starts off with, I'm interested in medicine. You know what I mean? The other thing I'd say is, the way I used to structure my explanation is like, we used to use this in school for like English, it was like point, evidence, explanation. So if you're going to say, I am an empathetic person, then you want to say, what is the evidence for that? Like, did you do volunteering? Were you taking care of somebody? And then you explain why that role makes you an empathetic person, if that makes sense.
Yeah.
So that structure is really powerful, because it shows the examiner that you've thought it through, and you kind of just giving evidence. And lastly, I'd say like what Alex said about highlighting your strengths. Don't feel the need to highlight everything you've ever done, because that can just get chaotic. Just choose a few of the best ones that you think are the most powerful, and then spend time on those, because you don't have very much space. So that's what I'd say. Thank you,
Sahara. Following up on that, maybe some of our staff could come in and comment about the importance of personal statements these days. To what extent are they used at interviews? To what extent are they even read, if someone's asking? Derek?
I'll say a couple of things. It was interesting what Sahana then said. Yeah, people spend so much time thinking about what they're going to write in their opening sentence. It's not a Nobel Prize winning bit of literature that you're writing. You're just starting talking about you. It's your personal statements to talk about you. I've read things in the past. I wandered lonely as a cloud and knew I had to be a doctor. When I dissected my dead goldfish, I knew I had to be a pathologist. Don't put something crazy like that. Yeah, that might stick in the mind of the reader, but again, as Hannah said, you do read lots of these things. And the other thing, don't tell people about what medicine is. The person reading is going to know. So, medicine is the marriage of science and art. Yeah, we know all that. Don't waste words on things like that. I'm studying biology because, try and avoid those sort of things, I think.
And to what extent, how important is the personal statement in terms of your course, Derek?
For me, yeah, it's important, but it certainly isn't the be all and end all of things. We want the interest and, as I said, the knowledge of what the subject is coming out, and the evidence of a nice rounded person. But for medicine, it's an art in itself, isn't it? Writing the personal statement. Okay. And I'm sure Naomi's going to jump in with something there.
I think, Naomi, I think you were.
Yeah, I was just going to follow up on what Derek said about that. Yeah, you're right. It is part of the admissions process to select for interview. If you go on the Medical Schools Council website, and I'd certainly suggest that you all do that if you are thinking about medicine, every single medical school across the UK all the admission criteria for every single university across the UK is on there, and it will tell you about the personal statement. So for instance, if you go into the Cardiff admissions policy statement, it will tell you what points we're looking for when we're looking at personal statements, what you need to cover. I think it is important to a certain extent, but we also know that you will have got lots of people to read the personal statement, and you'll have been spending ages on it, like Derek says. So it isn't the be all and end all. And we certainly, at Cardiff anyway, we don't have your personal statement in front of us when we interview you. So once you come for interview, we don't know what your grades are, and we don't know what your personal statement has said. So what we suggest that you do is you can use your personal statement during the interview process. So you take examples from that and build on that sometimes as well. But that's how Cardiff use it. But if you look at every other medical school website, they will explain exactly how they use it at their medical school.
Thank you, Naomi. Lee, I think you were next in.
Yeah, Naomi said all the things I was about to say, actually. So I do interviews as well, and yes, you don't see the personal statement. You don't. All you have is a name for a person. So obviously you can use parts of it, but I think what Zahana said, I think, is really key for interviews, is when you're asked a specific question, and I don't know, what do you understand about empathy, for example. It's really important to reference your own personal experiences and back that up with evidence, because anyone can regurgitate a definition of empathy, and you can read that up. That doesn't necessarily mean that you know what it means or the significance. So I think really key when you're doing your interviews is backing it up and making your answer relatable to your own experiences. I think it's really important.
Great, thanks, Lee. Alex?
Yeah, I just wanted to add from what I originally said as well, and what Derek was also mentioning about when, you know, you can regurgitate all these, you know, the marriage of science and medicine or whatever it was. But basically, I think what's really interesting in the personal statement is to read something that's quite unique. So when you're thinking about what interest you have, go do some reading around, you know, what's in the news. And there might be something, a story that's really compelling. For example, I don't know, you might read about CAR T therapy and how that's revolutionizing cancer. And to reflect on that in your statements and talk about that is really interesting. It shows you have interest, you've done some reading around it. And, you know, everyone's going to have a different interest within medicine or research, so discussing that is a good opportunity. Again, an interview, if that comes up and you've done some reading around it, it looks impressive, it just demonstrates interest. And I think that's what you know, they're looking for in the personal statement. You interested in this career, and what sort of, you know, background reading you might have done to demonstrate that, or what have you done to demonstrate that, and how have you reflected on that. So there's a few little things you can do, but yeah, just reading around subjects and things you're interested in is also a good way to explore before you even get to, you know, on the course as well.
Great, thank you, Alex. Guys, I'm just going to turn the next question round a little bit and reformat it. In what qualities would you look for in a colleague? So that hopefully will allow us to bring our scientists in as well as our medics. So what qualities would you be looking for in a colleague, do you think? Anyone like to start us off?
Okay, if you want. For me, it's in a colleague, it'd probably be someone who is like helpful. Science is a very collaborative field. Like I know, like, you might think that medicine is really competitive to get into and stuff, but once you're actually in a science field, it's all about helping others and helping even in your work. So yeah, being able to help others and like share skills and stuff like that, I think is a really good
trait to have. Yeah.
Thank you. It's nice to be a nice person as well.
Yeah. Great. Lee?
I think enthusiasm and being inquisitive, I think they're really important in both fields, medicine and research. I think it's really important. If you're enthusiastic, if you're interested in the topic, that people will notice that, and I think that creates a positive environment. But also being inquisitive, particularly, well, with both fields, it's important that you're inquisitive and you kind of explore different areas or aspects. So I think that's really important skill, both for both aspects.
Great, thank you. Nia?
I'd also say, on top of inquisitive and sort of team working, is to be a good communicator. So to be able to tell people when you need help or if you need help or what your ideas are, because that then helps with the collaboration and getting your lab to help you, and also sort of showing what you found, or how you're going to write it or talk about it. And yeah,
no,
doing
that's
good teamwork and having good timetabling skills.
right, yeah, excellent.
Because it's your schedule. You're completely in control of your own schedule. So if you can't timetable your schedule, then you're going to find out that all your experiments that you could have done all week are going to end up on the Friday, Saturday, and Sunday, and then you don't get a weekend.
Sure. Yeah. So good time management, important. Yeah. Great. Rosie.
I think everybody's really right with like team working, being enthusiastic, good timetabling skills is great. And I think being respectful of everybody in the lab, because it's one of the really nice things that there's so many people with different skills. So we have bioinformaticians, we have more clinical people or clinical roles. We've got so many different people and everyone has a different skill and you can learn something from everybody. So kind of combining all of those skills that everyone's talked to together and then being respectful as well, it just kind of makes for a really nice colleague to work with.
Great. Thanks, everyone. Francis.
Hi, as a medic, can I just make the point that for all of you looking in, it really is very important you take home the message that medicine is far more than just studying medicine, and that if you want to help people, the greatest creators are our medical scientists. Many people are medicine is a very, I love being a doctor, but it is as a course, you have to remember that medicine is very much a straight ahead. You've got to learn all these things because it's vital, because we're subject to assessments which are governed ultimately by the GMC in order to make us safe doctors. And that's great, but there are always amongst the medical course some brilliant and creative scientists who might have been more fulfilled actually studying a science pathway and possibly applying it to medicine. That's not to diss what I've done, because I loved what I do, but I am not a great scientist. That's the first thing. And I just want you, when you're making your decisions, to think about that carefully.
And Francis, what qualities do you admire in colleagues?
So my science, in my science colleagues, as opposed to...
Well, both science and medical colleagues.
So we've got lots of things that are really similar. For example, team working, we hope, respect for each other. I hope we have a fair bit of kindness nowadays for colleagues. All medics and scientists are inveterate overworkers. And that is a plus and a minus, I think. So I've got lots I admire in both. What do I admire as well is sometimes inventiveness, the ability to look at problems sideways on, and that is something that's incredibly useful, and it can be incredibly useful for scientists, because all those major new innovations, I can't tell you, I've been a doctor a very long time, and the whole of medicine has changed in my medical career. And a lot of that is due to brilliant science innovations. I'm not going to bore for Britain, but it is, when I came into medicine, the common treatment for gastric ulcers was surgery. And now, because of the wonderful drugs we've got, due to medical pharmacologists like Derek and people, people don't need to have that, and people have a completely different future. So I would just say that it's very important to embrace the width.
Excellent, thank you, Francis. So if I could maybe move to one of the other questions, I'm going to turn that round slightly as well. And I'd just like to ask all of you, what perhaps have you found challenging in your careers and training thus far, and what have you found particularly rewarding? So that can apply to our MBBCH and PhD students. Who'd like to start us off? Sahana, I see, are you willing to start us off there?
Yeah, thank you. I think I really enjoyed it. I couldn't see myself doing anything else. I'm really grateful that I've made it here and wouldn't have any other way. And I think the best parts of the experience so far have just been, you know, you can sink yourself in as much as you want into medicine, and obviously you have to study for exams and you have to do the bare minimum and follow the curriculum. But I think the best part of medical schools, at least Cardiff, is where they allow you to kind of go on your own path and you can figure out what you're interested in and soak yourself in that, and you feel really good about it. And I really enjoy the opportunities to do that. And having said that, though, I think the biggest challenge I experience is the steep curve from A levels to uni, where the learning method is so different and the standard is very different. So what you're used to just kind of learning mark schemes and finding trends and answers and going to an exam and regurgitating information, none of that happens anymore. At least not my experience. And the way you learn is very different, and the sheer volume of information is very intimidating. And you kind of have to get your head around it and how you're going to learn, because everyone has different ways of learning. And if somebody is going to do one thing and take notes a certain way, it's not necessarily going to work for you as well. So it took me a long time to kind of figure out what works for me and what doesn't. And I think I've kind of reached the nice in the middle zone. I mean, I touch wood, but yeah, that's what I'd say my experience has been.
Thank you, Sahana. Toby.
Yeah, I completely agree with Sahana. It's a very different way to learn to A levels. I think like volume wise, you do have to learn just a lot of information, and I probably thought med school was going to be more like problem solving based, and it is so problem solving based because every patient's a problem, or not a problem, but you have to work out what's wrong with them and how to manage them. But you can't do that if you don't know like the basics and the content, and that makes up so much of it. So in that sense, I'd say it's more like A-level biology than A-level chemistry, from like having to learn just sheer volumes of information. But then from a challenging point of view, I think because you can't learn everything, and it's just finding that balance between learning the right amount that's going to be sustainable for you, because it's so easy to burn out if you just like absolutely gun it trying to learn everything, and you just can't do that.
Mm-hmm. Thanks, Toby. Great. Alex.
Yeah, no, I completely agree. So I'll start off with sort of the challenges that I've faced, specifically for medicine. So as Toby and Simon are saying, I think with medicine, there's so much body of knowledge that you could acquire, and there's never sort of it never really ends. There's so much information that is available. It's about doing as much as you can, and sort of studying is very different to school. You can't cram in the last minute. You've got to cumulatively pick up your knowledge throughout the year. So attending your placements, and just being very inquisitive, asking questions there, and then spending some spare time here and there just to read up on what you've learned, and to expand your knowledge. So cramming is something that you can't do. So that's a bit of a difference between school and then going to medicine. I found it sort of potentially quite difficult. It's very important to remember that we're going into at least a 5-year course if you do medicine. It's potentially 6, which I've done a 6-year one, and it's a long time. So you've got to really take that in mind. Do you really want to do medicine? Because 6 years is a long time, and so it's important to really think about that, because a lot of your friends will go off and do other things, and you're still studying. So being a student for 6 years is a commitment. So it's really important to remember that. But on the flip side, there's some really amazing things throughout medical school that I've overall really sort of really enjoyed, and it's been a really great experience. So first and foremost, getting involved with sort of lots of projects and collaborating with different people is something I've really enjoyed. So working on sort of research projects, being being involved in lots of different societies. So you get to meet lots of different people in different fields, whether that is within healthcare, sort of research to scientists, people doing PhDs, or whether that's within the university itself and other students doing other courses. So there's lots of different things to collaborate on. I think collaboration is such a key thing within the course itself, but also just during your time in university, so working with other people. And I think there's so many different opportunities out there you can get involved in. And then lastly, I think I forgot what I was going to say now. Was it? I always slipped my mind. I'll come back to it. Yeah, I forgot what I was going to say.
We'll bring you back in a moment, Alex. Yeah, maybe I could bring in Rosie next.
Yeah, I really agree with what Alex is saying, that collaboration is one of the most rewarding parts of being to do with medicine. It's been amazing because you learn from different people, you get to meet so many different people, and working together to find a solution to something is so lovely, and it makes you feel like you've really accomplished something. But I think as part of that, it was one of the biggest challenges that I found moving forwards from school and from college. When I was applying for university, it always felt like we were being like pitted against each other for places at university, for the best grades. And I didn't study medicine at undergrad, I studied biochemistry. And from the very first lecture we had, it was really emphasized to us that working together was going to be the best way to really achieve something. And I remember the first time we had a piece of coursework, we all sat together and tried to help each other through it. And having that encouraged really helped to switch from the mindset of, I've got to do this for myself, to where I feel like we're all getting to now is we can really help each other, and we can become better medics or become better researchers if we work together and help each other. But I do think that was a really, really big challenge to kind of get through. And my degree wasn't ranked at the end. So I can imagine that might put a little bit more pressure on if you're being ranked at the end of your degree. But I think not understanding that helping each other is better was fantastic. And that's been both a big challenge and really rewarding.
Thank you, Rosie, for that insight. I think Naomi was next. Naomi?
Yeah, I was just going to sort of follow up on some of the comments that others have made. Medicine is an academically tough course, but also at the end of the day, what you're producing are doctors. So these are doctors who are applying their knowledge to patients, and you've always got to put the patient at the centre of your decision making. And actually, that's one of the biggest challenges. It's communicating with the patients, sometimes with relatives, in sometimes very difficult, stressful situations. And it's then coming back to that multidisciplinary team approach, realising that sometimes you don't always have all the answers. You have to involve other people to help problem solve, to help patients as well, and putting them at the forefront of it. Workload management and prioritising is really, really important, because you've got to work out how you're going to manage your time, because it is precious, but also you've got to do the best for each patient, because they are all individuals. And I would say that one of the big things at the moment as well is thinking about how you're going to manage those stresses in work. So what are you doing outside of work to make sure that you can perform well in work? Because you can't be working 24 hours a day. You have to have some downtime, and you have to have ways and recognise the ways that you need to switch off, and you need to recharge your batteries, and you need to feel better as well. So those are the challenges I think that you really need to think about, because some of the other things are, Lee's doing a PhD now, for instance, after doing a medical degree. I think I've still been doing exams up until maybe last year or so. Medicine is continuing. You are learning throughout your career. There is no point at which you never stop learning. So it's a career that you go into knowing that you're never going to know everything about everything. And you have to recognise those limitations in yourself and work out where to go for help for those as well. So those are challenging.
Maybe Lee, you could come in at that point.
It's led quite nicely to what I was going to say, actually. I think one of I kind of came into I did a degree before medicine as well, so I'm a bit of a glutton for punishment. But I kind of came into medical school thinking by the end of medical school I'll know everything and it'll be fine, it'll be straightforward. Well, not straightforward, but I'd know the majority of the information. And I think you learn very quickly that the volume is just insurmountable. You can't know it all. And at the end of medical school, it's literally like, it's kind of almost an introduction, and you're constantly learning throughout your career. And although initially that's quite stressful to think I can't know everything, actually in another sense, it's quite enlightening, because you're always learning something. You're learning something, whether that's from colleagues, whether it's from patients, from experiences. So it's both a positive and a negative. And in terms of positives, I think in terms of my own career, I by doing research and clinical practice and straddling that line between the two, I can see clinical problems or challenges in clinical practice that I can then bring to my research and think, how would I address that from a research perspective? But also going the other way. So I work with other researchers, and being able to give that clinical knowledge and say, look, that I'm not sure that's actually going to work in clinical practice, or yes, that might work, I think is really useful and unique, particularly if you're straddling both.
Great, thanks. Thanks again, Lee. Toby.
Oh, sorry, I didn't mean my hand to be up. I was busy
Okay.
typing another question.
No worries. Maybe Alex, you wanted to come back to us.
Yeah, I remember what I was saying now. So basically, I just wanted to finish off two other points I think is really positive about healthcare in general, and sort of what I've experienced. And one of the things I wanted to talk about was just about how once you find something you're really interested in within healthcare, medicine, research, wherever it may be, finding a mentor who has the same interest as you. I've found almost 100% of the time everybody really wants to teach you, support your learning, and they're just really supportive and really helpful. And that's been one of the great things about sort of this medical degree that I've been on. And whenever I've had an interest in an area or something, there's been lots of great mentors to help me and support my learning and teach me. And I think that's one of the really great things about there. It's great teachers within medicine. And yeah, I think that's one of the great things. And then just add on in terms of the medicine in general, or healthcare, the future healthcare is so bright. There's so much, we've only really scratched the surface of it. There's so much innovation out there to be done, explore. And the way we're training and practicing medicine now is not the way I'm learning it is probably not going to be how we're doing it in 20 years time. There's so much more to learn and explore. And I think it's just such a bright future for it. And that's one of the things that really strives me to be involved in this industry, just because the amount of innovation and research that's going on out there is going to revolutionize the way we live our lives. And something that really sort of grips me to keep learning. And
excellent points, Alex. Thanks very much. So there was a question earlier about
goes on.
Sorry, Alex.
Oh, I was just saying there, so I drop out. When I said one of the great things about medicine, you just keep learning, you just keep expanding that body of knowledge. And I said just there, the future is really bright. So it's a great sort of area to get involved in.
Indeed. Thanks again, Alex. A question earlier about maybe making a sort of sideways move at some stage in your career. Is there an option to change or move courses? I'm interested in studying a degree in one of the medical fields. I'm not really sure which one I'd be more suited to. I'm worried that if I commit to one and realize it's not for me, I might be stuck. Anyone got any thoughts about, anyone made any kind of changes in direction in their careers?
I can talk a little bit about that, James.
Yeah, please, Derek.
Having done a BSc in zoology and then a PhD in pharmacology, and now for my sins being, the professor, the director of the program, I definitely changed myself, I have to say. But you find your own way. That's the important thing, I think. And we said that earlier on. You do things that you want to do. I'm still learning pharmacology, I have to say, but. As an example of somebody who did medical pharmacology, so one of my students who graduated last year got a first in medical pharmacology. So they are at the moment up in Edinburgh doing a master's in reproductive science, and they've gone and got themselves a PhD position in Newcastle, Australia, to do a PhD in reproductive science. So, you know, that's a really good example, and we've got plenty of those. You know, that students come in and they do one thing, and then they might do a master's degree because that allows them to make a night's move. You know, they got an interest in another area, so they go and you know, gen themselves up in that area, and then they'll maybe follow a career in something else as well. So yeah, there's plenty of scope, definitely.
Great, thank you, Derek. Lee, I see your hands up.
Yeah, I made a few sideways moves kind of getting into medical school. So I didn't do medicine first around. I did medical biochemistry for the reason that I didn't think I was bright enough to get into medical school. So my rationale for doing biochemistry was fairly basic, if I'm honest. I liked biology and I liked chemistry, and a degree that did both was great. So, but I think the key thing for me is that if I had to do my time again, I would still do it the same way, because I think during those 3 years I did my undergraduate, I learned a lot of really valuable skills for medicine. So a few things about learning your own style of learning is really key. And I found that when I came into medical school with colleagues who were struggling at the start, I'd already knew the best way that I can learn and the most efficient way. So I was able to bring that along. And also, if you go into any kind of science related degree, there's always going to be things that are transferable. There was lots of things I did in my undergraduate, for example, immunology, which most medics kind of absolutely dread and find really difficult. But I'd done that as an undergraduate, so it was fine. So what I'm saying is, if you're still unsure about doing medicine, you don't necessarily have to go into it first time. There's loads of opportunities to go in as a postgraduate, and I definitely don't think it's a hindrance at all.
Great, thank you, Lee. Nia.
I was going to say that when I applied for university, I knew I wanted to do a medical science. I didn't know which one, so I did biochemistry because I thought that's a nice platform. And then I realized in one of my modules we brushed on some immunology, and I thought, oh, that's something that really interests me. So then that's when I moved to immunology for my master's. And then my master's courses, we had people that did engineering previously as their undergrad. There were other ones that had done just chemistry, or it was their first time doing a biological science. And then they moved from the immunology masters to their PhDs or going back to medical school afterwards, after they've done their, so they use their masters as the platform then to move somewhere else.
Great, thanks, Nia. Francis.
I was just going to try to basically agree with Lee totally about doing medicine potentially later. Now, I happened also to be a graduate into medicine, although I had a big change from a social sciences subject into medicine. But Lee is absolutely right. And I think it's worth remembering that not quite 50%, but a substantial minority of applicants to medical school nowadays are graduates, and there are specific graduate medical programs run in most, not all, but most medical schools. And they're 4-year courses, and if you do a 3-year degree and 4 years of medicine, it's only 1 year more than if you do the same thing as part of an integrated medical program. And there is a lot to be said for doing something else first.
Great, thank you, Francis. Amy.
Yeah, I was just going to say about trying to figure out what you like. Sometimes you might not even know the field that you're going into exists. Like, I knew that I liked genetics, but I'd never even heard of bioinformatics, and the only coding thing that I heard of before that was people who did computer science A-levels. I didn't know that biology people knew how to code, and also how I could learn how to code. So yeah, when I went into my first year of my undergrad, I didn't even know that was a thing, and now I'm doing it. So just because you don't know everything or you don't know where you're going to be doesn't mean that you won't get somewhere that you enjoy eventually. Yeah,
that's great, Amy, thank you. Well, guys, I think our time is running out. So I'd just like to thank you for your superb insights this morning that were delivered in such an articulate fashion. I'm sure our attendees have much appreciated your wisdom this morning, and I'm sure those who access this recording in the coming days and weeks will also be very appreciative. So once again, thanks very much for your valuable time this morning. I know, Karen, you want to come in to use Mentimeter to capture some feedback from our attendees. So I'll hand over to you now. But diolch yn fawr, thanks once again to everyone who's participated this morning.
Yes, thanks, James. If I can just ask a few questions just to get a bit of feedback from our attendees, that would be much appreciated. So I'm just going to share my screen here, and I'm going to ask you to log into Mentimeter once again. Okay, hopefully you can see my screen. So if you go into Mentimeter and use the code there, that's 67900933. I'll give you a moment just to get into that. So our first question then is if you can say which of the live sessions you've attended this week. I can't believe that we're finishing already, and it only started yesterday. Seems to have been quite a lot. Okay. Right. Okay. Obviously, you've all attended the Ask the Expert panel as you're here today. Glad you managed to get to some other sessions as well. So moving on to the next question. Can you describe your experience of guest to healthcare session if you were in that session? Give us up to 3 words. Good to see informative there. Hopefully you found it informative. Just to give you an overview of some of the other roles that are available in healthcare. Great. Yeah, that's good. Glad it was fun and interesting. Just to give you ideas that there are other options, as we say, apart from medicine and science. Okey-doke. And then next, if you could if you were in the Young People's Mental Health panel, if you could just give us some of your thoughts about that. That's insightful, helpful. That's great. That was a very interesting session. Those of you who are here today who may have missed yesterday's sessions, we will be sending out the links to the recordings of all sessions, so you can catch up with those. Okay, so this was the Q&A session first thing this morning with our programme contributors. Right, that's good. Glad. I know our attendee numbers have been quite low generally, but it's great to know that those of you who've joined these sessions have found them really helpful. And describe your experience of superbug session with poor old COVID John. Great, good feedback there. I'm glad It was unique. It is a really exciting project. Hopefully you'll go and take a look at the website. Plenty of activities there. Okay, and then your experience of the session that we've just been in, Ask the Expert panel. Great, that's really good. It's really valuable for you. And yeah, have to agree that we did have very great panelists today. Reassuring, amazing help. It's fantastic. Compelling, that's good. As long as we haven't put anybody off, we've done well. Okay, so do you think the participation will help you to complete your UCAS applications? Hopefully it will. Give you something to think about. Yeah, 4 definite yeses, which is great. Okay, I know we were quite late sending out the pre-recorded videos, and obviously you have the links to those which will you can view in your own time. Great to see that quite a few of you have already viewed some of them. Excellent. How would you rate the pre-recorded resources? It's good, glad they're great, predominantly great. Fantastic. Hopefully you'll get a chance, as I say, to view a few more after the event. And which video did you, if you've watched some of the videos, which one did you find of the most interest so far? Okay, music one, yeah, that's good fun. It's good to see the live singing this morning in the session. That was quite interesting. Yeah, Century of the Brain, yeah, it's a really good one. That's great. Thank you. Okay, so hopefully the event has inspired you towards a career in science and health. Pleased to see you agree there. Yeah, move on. So what sort of careers are you interested in, just out of so biomedical research? Okay, dentistry, medicine, great.
I've put my email in the little chat box thing, so if anyone wants to email about anything, I'll always reply.
Oh, thanks, Amy. That's great. And I know you've probably all got either my email address or our Medic Engagement email address. So likewise, feel free to email me with any queries for any of our panelists from any sessions, and I'm happy to forward any queries onto them. Okay. So, has the event helped you to further your future career goals? Yeah, lots of yeses, that's great. Are you more or less likely to study at Cardiff after attending the event? I'm very pleased to see everyone says more likely. We certainly look forward to seeing some of you around in the next few years, and maybe you'll be on one of our panels one day. So what action or follow-up will you take as a result of participating? Great, thanks. Yes, I do recommend watching the presentations. They are really worth a watch when you've got time. Some more research and volunteer work experience. That's great. Okay, so overall, just let us know. Thought the event was glad to see we've got lots of epics and goods. Really pleased about that. Thank you very much. Okay, great. Yeah, I've got email addresses, so yeah, really pleased that thanks for putting your names in for the prize draw. Also on the programme, you would have noticed that we've advertised a quiz that you can take part in after viewing the recordings. We were going to announce winners today, but I know a lot of people obviously won't have had a chance to have looked at the quiz yet. So we'll keep the quiz open for another week or two. So if you get a chance, have a look at your programme, look at the link for the quiz on the back and take part in that. That's quite good fun. There's a chance to win Amazon vouchers for first, second and third place. And obviously we've collected your feedback today, but there is a chance to complete evaluation with a link at the back of the programme for that as well. And we, as I say, we will be drawing out a name for prize draw for a £10 Amazon voucher. So thank you very much. It's been great to be with you the last 2 days. I'll just hand you back to James just to conclude the session this morning.
Thanks, Karen. That was very valuable. So once again, thanks to our panel this morning. Thanks to our attendees. We wish our attendees all the very best with their future studies, and I hope that we might cross paths at some point in the future. So thanks once again, everyone. Diolch. Bye.